of that review discussion process. We then move to a summary of this report, where we will work with organizations and work with the systems and say, based on what the scan has revealed, and based on what we're hearing from, those individuals who are engaged and who are involved, these would be, some suggested areas to work on. Somebody may say, the scan may reveal that, Keith, we can't ever get our data correct, or our data is inaccurate. And so we need to have a better drill down to look at how we can analyze and look at our data and disaggregate our data so that we can have be better informed around what practice recommendations or what practice changes. And then come in and work closely hand in hand with those jurisdictions and with those systems and what level of technical assistance that matters. I'll also layer on top of that, all of this is done fully staying connected to looking at it through race equity lens. And I also want to say that we fully recognize that some of the challenges that organizations and systems currently have with some of the efforts underway related to suppressing that activity, requires added strategy and added willingness. And so if there are organizations, jurisdictions out there who have the will, we believe that we can assist and we can support. So that's kind of the process. And we are going to share with you a little bit about how we're going to connect with each of you and how you can connect with us about what that might look like in your spaces.
Thanks, Keith. So this is something that is new to the race equity strategy areas. We've added a rubric that we call a jurisdictional scan and assessment tool. So Keith mentioned that in the previous slide, that this is a starting point. So this is the opportunity for the organization to really examine each strategy area and assign a rating based on the evidence that exists in that particular strategy area. So you see here that we are focusing on prevention services in this particular strategy area, which is child welfare intervention, child neglect intervention. The corresponding objective is for us to identify the elements of a continuum of care that addresses child neglect intervention from a preventative, mitigation, recovery, and anti-racist lens. So that is what we're looking for. And we're, again, looking to partner with you. We want organizations to complete this. It can be a team that completes it. It can be the executive that completes it. But then we'd like to come in and discuss this with you. What does this mean to you as you think about all of the strategy areas? This is one way that you can determine a priority for which strategy areas you really want to focus on at a particular time. So, as Keith mentioned, the 12 strategy areas are all important. We do put them in somewhat of a priority order, in that we want you to first think about data, right? That's our first strategy area, disaggregating it. Then we want you to pay attention to how the services are financed, right? Are we using all the available resources to support families? And then we get to the third strategy area, which is the child neglect intervention. We go from there to kinship, because if a child has to come into care, they should be with family. And if they're in care, parent engagement needs to be the priority. So parent engagement is strategy number 5. Community engagement for family support is strategy number 6. So there's a priority order indicating what organizations need to emphasize, right? As you think about your race equity journey. But it's not something that we expect or advise you to do all at once, not all 12, right? Use the rubric and work with us to determine the priority and the sequencing specific to your organization. So, Orande?
Indeed, indeed. So a couple of things I want to acknowledge. One is that, you know, all these institutions are not static. When I first started working in the field, some of the conversations that were happening were around sort of creating more flexibility for relatives who have been incarcerated to play some role in caregiving in those instances where it makes the most sense. And so I say that because there have been some real progress in terms of policies and sort of loosening some of those standards, and some of the conversations that we hear and see today is sort of going back to some of those same conversations that were happening about 20, 25 years ago. And so in that sense, just acknowledging that our systems are not static and they're always changing, and sometimes making progress and sometimes regressing. And so in that context, I know we've shared a lot, and I'm just curious, you know, if for those of you who are listening, as you think about whether it's your institution or if your institution is working alongside a public agency, and it could be child welfare, it could be one of the other human service agencies or others. But as you sort of listen to this, and especially as you reflect on the racial equity strategy areas, what would you say are some of the things that are sort of coming up for you, either in your institutions or in the jurisdiction that you all are working in? And if you would mind sort of putting some of that in the chat. Just curious about what's coming up for you all. Any of these areas that seem particularly relevant.
Please share. Kinship.
Kinship. Indeed, there continue to be detractors.
Parent engagement and support appears to be lacking across the board. I think, Angela, sometimes there's that struggle, or we hear that there's a struggle around what engagement actually means. Does it mean that I met with a family 5 times and therefore I'm engaged? But once again, their circumstances hadn't changed. So I think also getting to an understanding about what engagement means is quid pro quo. You know, we need to understand what we're giving and what we're taking, and that we can jointly see through similar lens.
Yes. I know that engagement from a parent perspective is that as a birth parent, I need to be engaged by that caseworker, not the parent partner mentor, not the peer mentor, whatever they choose to label them within their service. I need to be engaged by that caseworker who holds my family's future in their hands. I don't need a middleman. I don't necessarily need a foster parent mentor to mini social work me. Just being real clear on that. We want to keep engagement, family engagement, separate with racial equity, but to include both of them in tandem as we're working towards equity, racial equity, and inclusion of both. And systems are missing the mark there, and I don't even know that they're missing the mark. I think they're dodging the mark.
Mm.
This has been happening for decades. And just like the disproportionate numbers haven't changed, what, in how many years? 60? Neither has engagement over the last 20, at least. So how do we make sure or ensure that that is one of the main strategies for RESA?
Thanks, Angela. Ronnie, it appears that we have lots of comments around that whole community engagement and family support. I know Sister Vivian shared that oftentimes community and family engagement, that we don't elevate or lift, and celebrate with families. Vivian, I'll just share, I've had lots of conversations with agencies, organizations, and jurisdictions who are setting forth, talking about doing needs assessment. And I'm asking them, can you transform your language and your efforts? Why can't we do gift assessments? That there are gifts in communities that we talk about going into, we're working with. There are already gifts there. How can we maximize on the gifts that are there that lead to greater support and to greater outcomes for those who are served?
Exactly. Thank you.
And also want to acknowledge that Vivian Drayton is a former BACW board member, and we so appreciate her joining us today and adding her critical voice. She is a warrior for families. So thank you. And thank you also,
Thank you.
Angela Braxton, for sharing your perspective as a parent and family engagement advocate. And that's only a part of what you do. So, but it's critical though that we keep these issues on the table, because as has been said, the way we're working isn't working, right? How can we transform systems so that we're not harming families?
Yeah, and Yakisi, one of the other things that I'll add, and some of our experiences has been as we work with agencies, jurisdictions, and organizations, we find that through discussions, sometimes we have to get to a RESA parent engagement and support 2.0. And when I say that is that in some jurisdictions, it's determined that there is a lack of attention to fathers being engaged, and that perhaps is a priority focus that should be undertaken, and that while it's not listed specifically as a particular strategy area, it can be an offset or an offshoot of some of the conversations around and with some of the RESA strategy areas. Yeah. So I just wanted to elevate that it's not just limited, but here's the starting places for some of those conversations. I also, and before Kirsten gets off, I want to elevate the great work that's being done from the preventative lens. This is not just focused for child welfare, but for human service agencies throughout the continuum, throughout the gamut, because you impact the lives of children, families, and communities. And we thank Prevent Child Abuse America for the work that they do as well.
Keith, one thing that I would add, especially thinking about sort of the intersection in some ways of community engagement and then some of the other strategy areas. And it sort of ties back to the conversation about sort of racism and how it shows up, and racism oftentimes in more subtle, or some would say unintentional ways. But just as an example, the relationship between community engagement, sort of engaging community partners, knowing what community resources are out there, and then the work that's happening in schools. And so I remember really great work that was happening in Connecticut. I'm not sure if that work is still happening, but it was really exciting as they started to unfold that work. but they were looking at the reports that were coming in from schools and trying to figure out sort of what's underneath that. And what they discovered is that kids didn't have coats, or kids weren't eating meals, or kids weren't getting sufficient sleep or rest or some other things, or comments about housing. And so, you know, not social workers, teachers or counselors at the school didn't really know where else can we sort of go to get some of these supports that some of these young people need. And so the natural go-to for them, not because they were trying to do anything harmful, but it was the child welfare agency. It was CPS. That was the only real way they knew how to sort of access services. And so the response tended to be more punitive. And so what the public agency did in that case is set up a partnership where they had social workers, you know, sort of embedded and engaged at the school. And the educators acknowledged, and the administrators, they didn't really know what else was out there. And so they went through an entire process to find out who are all the community partners out there, what kind of resources are available, and probably 80% that they weren't aware of. And so instead of having to refer to CPS, they were able to reach out and sort of contact some of these other organizations that could respond to families who have various needs. And so just to say that there's a sort of overlap in relationship between some of these strategy areas. And so even if you start to focus on one, you start to see some of the interconnections with others. And so it was exciting to see that work. And I suspect there's sort of more strategies that some of you all are already involved with.
Right. And and thank you, Arani. And I think the other thing that we do is we try not to start from that deficit model when we engage with communities and systems and agencies, because, you know, some of our work and some of our experiences has shown where, you know, I recall working with jurisdiction, and they thought that they were doing very poorly in the space of finances and tying all the resources together, and that data may have been off. But when we got in and we had the conversations, they were actually doing extremely well, and that we, you know, congratulated them for the work that they were doing, and that it is a great start, and that perhaps they can shift some of their review and their priority in some of the other RESA areas, and how it impacts from that positive side of the things that they're doing. So that's just an example, some examples of some of the work that's being done, or how we go about, you know, supporting and applying the work with the race equity strategy areas. And we offer that to you on this call. We offer that to the jurisdictions and the systems that you're working with. We ask you to leave and to think about how this shows up in the places and spaces that are being impacted, where there are children, families, and communities. Yakisi way?
Thanks, Keith. So thinking about the journey, where there's a will, there's a way. So Keith always says that we have to have the will to change practices and policies that negatively affect children, families, and communities. So this is something that we emphasize here, because for those of you who are in public organizations, you may have noticed that depending on who is at the helm, either of the agency or a political elected official who appoints agency administrators, depending on who those people are, the priorities shift. And so in many jurisdictions, we've seen excellent strategies implemented, but they don't continue, which is why we don't see the continuing decrease in the number of African-American children in the system, right? So that we could get to the point where we're not overrepresented. That has not happened. It's a will issue, right? And so that's something that's important to note. And so when you have a situation like that, one that is that runs counter to what we know is best for children and families, you need some ideas, some strategies on how to address that. RESA is a great way to start, because we start where you are within your agency and then talk about how to add those elements that have been identified as best practice so that we can get to a point of transformation in the system. It's not easy, but it's essential. And we owe that to our children and our families. So our next steps. So you all have identified some areas, not all of you, but some of you. And we will contact you. We want to follow up with you. We also are, as I mentioned earlier, we'll be providing some drill down webinars on each of the RESA areas. You may contact us via the BACW website at blackadministratorsinchildwelfare.org. And we hope that these contacts result in a formal engagement relationship with BACW to begin your journey. Keith and Arande, we have about 11 more minutes before our time is up.
Okay, Arande, I'll let you share and then I'll close.
Well, I really just want to make an appreciation for people's participation, and probably most of all for the work that you all are doing every day. These dynamics are not new. These conversations certainly are not new. One of the sort of conversations that is sort of happening is, and I sort of referenced this a little bit, is that these things are cyclical in many ways. And so agencies, and I'm saying the range of agencies that are out there charged with supporting families and young people are not perfect. And some really make progress in some areas, and that progress may last for a little bit of time, but when there's a shift in leadership, or there's a shift at other sort of areas of an organization, then you see, it's like any other organization, we revert back to some of the things that we're most familiar with. And so just an appreciation for the work that you all are doing. I think another thing that I'll say is, sort of thinking back about some of the context setting at the beginning, is this whole thing about policies and practices and then hearts and minds. And I think the thing that I'll sort of end with is, it's not either or. And I think Keith was getting at some of this as well. It's not either or. And so to the point of, some of the progress that agencies make not being sustainable, and even some of the leadership shifts that may account for some of that, we can do the hearts and minds work, which is really, really important work in its own terms. But if it doesn't somehow have an impact on how the organization or institution functions, then it's not too much benefit to children and young people and families that are coming in contact with these institutions and systems. And at the same time, if you do the policy and practice work, but you have not changed the way people fundamentally think about and in some ways judge families, then you can have those policy shifts, but it's not really embedding because people haven't really taken to it, and it's not really grounded in the way people think about families. And so both sides of the work are important. And so I think you'll find, opportunities to engage in all of that work as you begin to engage some of these racial equity strategy areas. And so just an encouragement to reach out and take advantage of, opportunities to do some consultation with Black Administrators in Child Welfare, the only organization in the country that is exclusively and explicitly focused on improving outcomes for Black children and families caught up in these systems. And so thank you all. Keith?
Thank you, Arande. Thank you, Yakisiwe. And great thank you to everyone who participated here today just by joining. Hopefully you've heard some things that have moved you in a spirit of thought, hopefully in a spirit of action and a spirit of practice, that it's impacted your heart space and your mindset. But just recognize that I started out part of the conversation saying BACW started in 1971. Well, it's 52 years later, And there is still a great need for the work that's being done in advocating to improve outcomes for African-American children and families. And so the work is hard, the journey is long, but we must stay the course. We cannot grow weary about this work. And that through our connectivity, we hopefully can make an impact and make support greater outcomes for children, families, and communities. BACW has always been unapologetic in saying that we believe that if we solve the issues impacting and affecting the Black child, the Black family, the Black community, we will effectuate change throughout this entire country. So with that, we thank you. We will be reaching out to you. You will get a follow-up survey or evaluation, and it may ask questions about those 3 areas or the 3 RESAs that you believe might be impactful for your organization. So we thank you for your time. We thank you for your heart. We at BACW love each and every one of you. Thank you for all you do.
Thank you.
Right. Lisa, Keith, Harambe. I'm
You
going
might
to.
want to stop the tape.